Hello students, welcome to today's class. Today we are going to discuss about an interesting topic, powders from pharmaceutics. Let's see what is powders. A pharmaceutical powder is a mixture of finely divided drug or chemicals which is in dry form, and they are the solid dosage forms of medicament which to be used both internally and externally. Now let's see what are the advantages and disadvantages of the powders. Usually, the powders are used both internally and externally, and they are more stable than the liquid dosage forms. It is more convenient for the physician to prescribe a certain amount of powders. The onset of action of powder is very faster as compared to other dosage forms such as tablet, capsule, because these powders are easily dissolved in the body fluids. Next, these powders are easy to carry and it is also very easy to administer to the patients orally by dissolving it into a certain liquid. Disadvantages of powders. The drugs having bitter taste or causing nausea and unpleasant taste cannot be dispensed in powder form. The next point, the drugs which are deliquescent or hygroscopic in nature cannot be dispensed as powders as they require a special packing such as double wrapping. And the third point is the drugs which are affected by the atmospheric conditions are not suitable for dispensing in the powder form. And last is the quantities less than 100 mg cannot be weighed accurately and conveniently to dispense as the powder form. Next, let's see about the classification of powders. Actually, the powders are classified into four types. They are bulk powders, simple and compound powders, powders dispensed in sachets, triturated or molded tablets. Here, the bulk powders are further divided into bulk powders for internal use, bulk powders for external use. Here, the bulk powders for external use are further classified into dusting powders, insufflations, snuffs, dentifrices or tooth powders. Bulk powders for internal use. Bulk powders are the powders which are dispensed when the precise dosage accuracy is not required at the time of administration. These bulk powders are contains multiple doses of powder medications which is supplied in a single containers. Usually, the bulk powders are provided in a white mouth containers along with a spoon for easy dispensing by the patients. Examples are compound rhubarb powder like magnesium carbonate and heavy magnesium carbonates. Bulk powders for external use. These bulk powders are meant for their external use contains non-potent substances. These powders are supplied in cardboard, glasses or plastic containers specially designed and the method of applications. Usually, they are packed in perforated or shifted top containers for easy use. Common types of bulk powders for externally use are dusting powders, insufflation, snuffs, and dentifrices. Dusting powders. These dusting powders are intended for the external application on the skin. These dusting powders usually contains antiseptic, astringents, antipyretic, and antiperspirant agents. There are two types of dusting powders. They are medical dusting powders and surgical dusting powders. Usually, medical dusting powders are used for superficial skin conditions, and the surgical dusting powders are used in the body cavities, wounds, or umbilical cords for infants and must be sterilized before the use. Next, we are seeing about the insufflations. Insufflations are the medicated dusting powders which is directly introduced into the body cavities such as nose, throat, ears, and vagina using a special instrument called insufflators. Usually, these insufflations produces local or systemic effects, especially for the drugs that are destroyed in the gastrointestinal. Next, we are going to see about snuffs. Snuffs are the finely divided solid dosage forms which are inhaled through the nostrils. Usually, they are used to treat the asthma conditions, and it consists of substances such as antiseptics, bronchodilators, decongestants for local and systemic actions. Usually, these snuffs are dispensed in flat metal boxes or glass containers with suitable lids or extensions. Next is dentifrices. Dentifrices are dental powders used with a toothbrush to clean the surface of the teeth. They contain abrasives, detergents or soaps, antiseptics, coloring agents, and flavoring agents. Usually, calcium carbonate is commonly used as the base. Essential oils are also added to give flavor, freshness, and mild antiseptic actions. It is used to treat certain tooth conditions called plaques, gingivitis, etc. Next, we are going to see the second classification of powders, that is simple powders. Simple powders are the special type of powders which contains only one active ingredient. In this form, each dose of the powder is individually wrapped. For dispensing, the powder is accurately weighed, divided into a required number of doses and wrapped separately. For example, if aspirin is taken as an active ingredient, it is mixed with their diluents and further it is weighed accurately and divided into a required number of doses and wrapped separately. Next is compound powders. Compound powders are another special type of powders. In this contains two or more ingredients which are mixed together. In this mixture, it is divided into required number of individual doses and wrapped separately in powder papers. Actually, for example, if you take a three type of active ingredients which are mixed together and forms a mixture. For that, we have taken aspirin, paracetamol, and caffeine. All the three ingredients were mixed together and forms a mixture. This mixture is further divided into equal number of individual doses and wrapped separately using a powder papers. Next one is powders dispensed in sachets. First, let's see what is sachets. Sachets are the solid dosage forms used to enclose the unpleasant tasting powders. There are two types of sachets. One is wet seal sachets and dry seal sachets. Wet seal sachets are made up of two similar convex halves of flat edges. Here, the drug is placed in one half and the edges of another half are moistened and sealed by pressing. In dry seal sachets, the upper and lower half of their different diameters are used. The powder is placed in lower half and sealed by fitting the upper half using a machines. Next is titrated or molded tablets. Here, the powders are titrated and molded into tablets. Usually, the titrated tablets are flat, circular, and usually containing the potent drugs. Here, the drugs are also mixed with lactose, dextrose, and other suitable diluents before molding to get a perfect shape and size of a tablets. Okay, students, today we have learned about powders, their advantages, disadvantages, along with their classifications. Let's see you on the next video. Thank you.